Health Education Series, Module 2, Dental Caries, Part 1. My name is Dr. Brecky, and I will be taking you on this tour of one of the most important topics faced in the dental world, and that's dental caries. This project is in part created by Ready, Set, Smile. So this second module, split into two parts, focuses on one of the most important topics in oral health today. Just know that additional resources will be cited, and further reading on the topic is strongly recommended. Material is subject to copyright by Ready, Set, Smile and Dr. Brecky. So an introduction to dental caries. In today's lecture, we're going to review tooth anatomy, dental caries, the epidemiology of dental caries, the process of dental caries, and also risk factors and basic prevention. Dental caries is a unique, widespread disease that can be considered both chronic and infectious. That makes it unique. Dental caries is a preventable disease. However, it is 5 times more common than childhood asthma. So first, let's just review the oral anatomy of a tooth. As we discussed in the last lecture, anything above the gums in the mouth is typically considered the crown of the tooth, and that's what's covered by the strongest substance in our entire body, our enamel. Underneath the enamel is a hard structure called dentin. Dentin is a little bit softer, kind of like bone, and it protects the innermost layer of the tooth, which is called the pulp chamber, and that's where the blood vessels and nerves live, which keep the tooth healthy and alive. The roots of the teeth sit in something called a periodontal ligament, which is almost like a pillow that allows it to sit comfortably within supporting bone. As we just reviewed, our tooth anatomy, the enamel or the outermost component of the tooth, the dentin or the internal hard structure of the tooth that protects the pulp, and the cementum, which is the hard root structure, which is not as strong as the enamel. Remember, the cementum is only exposed in the mouth if periodontal disease is present. We'll get into that later. The pulp is the innermost component of the tooth containing the blood vessels and nerves. There are 20 teeth for kids and 32 teeth for adults in most circumstances. Dental caries is a disease process commonly known as tooth decay or cavities. It's a multifactorial progressive disease process manifested by the destruction of hard surfaces of the teeth when acid-producing bacterial species feed on foods and sugars in the oral environment. That's a mouthful. It's the #1 chronic disease among children and also the #1 infectious disease among children. Yet dental caries shares many common risk factors with other chronic conditions, like diabetes and obesity. It has been named a silent epidemic. How big is this problem? We'll review the epidemiology. It's the most common chronic disease in the entire world, affecting nearly 100% of adults worldwide, according to the World Health Organization. About 30% of US children aged 2 to 5 have dental caries in their primary or baby teeth. 15% of children in their adolescent years have dental caries in their adult teeth. And remember, those adult teeth are pretty new at that time. 91% of Americans over age 20 have had caries at some point during their lives. Among children, a vast majority of the disease is experienced by a small subset, about a quarter, of the population. What's the burden of dental caries? Well, the lack of preventive dental care results in an estimated 2 million visits to emergency rooms each year, costing over $2 billion to taxpayers. What happens to people who have dental caries? Pain, loss of productivity from school or work, loss of teeth, difficulty eating, expensive, time-consuming, potentially life-threatening dental treatments, which can even cause some anxiety, and possible, although rare, death from untreated infection. Studies have also outlined that dental pain is one of the leading causes of missed school days among children, which is a problem. Is it really that bad? Unfortunately, yes. Deaths, though preventable, still occur from untreated dental infections. And these are just some of the few that have been reported in news sources and have been acknowledged. Additionally, multiple deaths as a result of complications of anesthesia while undergoing dental procedures remains a crisis for both children and adults. Just remember, these deaths were all preventable. So let's go back to reviewing the relevant terminology. A biofilm is a complex film of bacteria which adheres to the hard surface, teeth, in the presence of water. The plaque is a bacterial biofilm which has grown large enough to be visible to the human eye and wipeable intraorally. It serves as a niche for hundreds and thousands of bacterial species. A pathogen is a bacteria, virus, or fungi, or other microorganism which can create disease. Just remember, the bacteria which creates cavities or dental caries are pathogenic. It is important to note while the focus of this module is dental caries, the accumulation of plaque and the buildup of things like calculus are also a key precursor for the development of periodontal disease, which is the leading cause of tooth loss worldwide. So, how long does it really take for this bacteria to colonize? Within seconds to minutes after eating or brushing, a fully established pellicle forms, or an acellular mass of proteins on the tooth enamel surface. Within hours, bacteria joins this mass to colonize the pellicle and form something called the biofilm. After 24 hours of not brushing this biofilm, the dental plaque may harden. And this plaque serves as a reservoir for cariogenic or caries-loving bacteria and other pathogens which grow and multiply. This is what fuels the dental caries process. And this is why brushing, flossing, and disrupting those biofilms and those bacterial formations are key. And just remember, it's something that we really cannot see in most cases, just by looking in our mouths. Let's review the stages of tooth decay. First, you can see a healthy tooth with just a little bit of plaque. Like we discussed, that leads to decay, which just starts in the enamel. As that progresses, the decay reaches the innermost structure of the tooth called the dentin. Uh-oh. And as it gets closer, the decay reaches the pulp of the tooth. And as you can see, once the decay reaches the blood vessels and nerves and live tissues within that tooth, it becomes problematic. And you can see this going right out into the bone. That's painful. So let's review the dental caries process. There are three main components of the caries process, which are all necessary and sufficient to fuel the dental caries. And these include the environment, the specific bacteria, and the specific substrate or sugars. All of these exist on a spectrum which also requires time to enable caries to form. Well, so let's take a closer look at the source, the bacteria. Streptococcus mutans and Streptococcus species of bacteria are some of the bigger known pathogens which cause caries. Just remember, there is no single species of bacteria which causes decay. There are multiple. In fact, there are over 700 species of bacteria which live in the oral cavity. They are very difficult to culture and study because it is very hard to replicate the oral environment in the laboratory. And yep, that's right, you can catch it. Dental caries is infectious. A child's primary caregiver, most often unknowingly, shares this infectious bacteria with the child by sharing foods and saliva. This process is called vertical transmission. However, as you can see by this picture over here, there are other ways in which one can get the bacteria to create cavities. Yep, that's right. Be careful who you kiss. So let's take a look at the substrate. And this includes the sugars, the diet, the carbohydrates, and even the frequency at which things are consumed. As you can see, candies, sodas, things like simple carbs like that are some of the biggest culprits in stimulating the Caries process. And the environment. This is the oral cavity, the teeth, the natural acids, our saliva, and our oral hygiene. The environment plays a big role in stimulating the Caries process. If you keep it clean, it's a lot harder. But let's not forget time and frequency. The frequency of meals, the time below the critical pH threshold, something we'll get into later, and the time between brushing and disruption of the bacterial biofilm are hugely important in fueling the Caries process in our teeth. The key is finding the balance between demineralization and remineralization. As you can see in this lovely photo by the NIH, bacteria and sugars cause the teeth to demineralize, to become weaker and less strong, whereas on the right side, our saliva and fluoride, those are what causes the tooth to remineralize or become stronger. And that's where we want to stay. So let's talk about something that'll make your mouth water. Saliva. Saliva is 98% water. It contains mucus, proteins, digestive enzymes, salivary amylase, and minerals like fluoride. But what's so important here is something called a buffering potential for anyone who has a background in chemistry out there. Every single time we eat, our saliva is what brings our mouth back to baseline because our mouth is what breaks down our food. It's an acidic, pickly environment, which is what it's supposed to do to start breaking down our food. However, our saliva comes on in and brings it back to normal so that our teeth aren't in a constant state of acid wear. Remember, poor salivary function, or dry mouth, is a huge risk factor for dental caries, and that is something that we will get into later. So let's review the chemistry. pH is a scientific measure for the alkalinity or acidity of a solution or environment. Remember, 7 is neutral. This includes things like blood or water. Less than 7 is acidic, whereas greater than 7 is basic. 5.5 is the critical threshold, or pH at which dental hard tissues, teeth, dissolve. So, demineralization is the weakening or softening of hard tissues, which include enamel and dentin, when the oral environment drops below this critical threshold. Every single time you eat or drink, your pH drops below the critical threshold. This is what helps to fuel the caries process because it's easier to permeate a soft tooth and create a cavity than it is to permeate something that's super strong and super hard. So we'll take a look at the pH scale. As you can see, 7 is neutral, and here it depicts water, whereas more alkaline or basic things have higher numbers, such as soap, bleach, baking soda, etc. Whereas more acidic, lower numbers include stomach acid, vinegar, orange juice, tomatoes, even, oh no, coffee. That's right. That's why our saliva plays a big role in taking care of our teeth. The power of sour. Yep, thanks to the MDA, we have this beautiful chart of what our favorite candies do to our teeth. and their acid or pH levels. As you can see, battery acid is at 1.0 on the pH scale, whereas Wonka sour or Warhead sour spray is only 1.6. Zowers 2.2. Let's see, we have Laffy Taffy 2.5, Skittles 2.5, Sweet Tarts 3.0, Sour Gummy Bears 3.0. Yep, best to stay away from all of that. And if you do, take care of your teeth. Baby bottle tooth decay. Well, it is very important to teach parents that they should never put a child to bed with a bottle containing sugary drinks, including, yes, milk, juice, formula, or soda. Why did I have to put that there? You would be surprised. At bedtime, always, always, always choose water. Those baby teeth are very, very prone to the caries process, and putting a child to bed with anything containing sugars, even natural sugars within milk, can cause the caries process to take off. So what are some risk factors for dental caries? Well, these include poor oral hygiene, a history of caries, high sugar or high carb diets, frequent meals and snacking, soda consumption, bottled water consumption, braces or oral appliances, or even the crowding of teeth. And the bottled water, we'll get into that later, but that's because it doesn't have fluoride. We always, always recommend water over any other drink choice out there. Other risk factors include genetics, age, medication use, history of dry mouth, socioeconomic status, bone or developmental disorders, mental health problems, and poor systemic health or overall health with conditions such as diabetes or substance abuse. The list goes on. So what are some steps toward prevention? First, visit your dental provider after age 1 or eruption of first tooth. 2, visit your dental provider every 6 months, or even more commonly, if that's what's decided. Number 3, use fluoride toothpaste on erupted teeth. Remember, that's 2 minutes, twice per day. 4, pursue preventive sealants on teeth with deep pits and grooves when a child is young. 5, eat a well-balanced diet and focus on reduced snacking frequency. 6, limit sugar-containing beverages and foods. Remember, only 1 cup of fresh fruit juice allowed per day. And also, put children to bed with water. 7, drink water from the tap if you can, not bottled, and also monitor fluoride. 8, if symptoms arise, do not delay care. And that's something we'll get into in part 2 of this module. So, thank you to our sponsors. With questions regarding this module, please contact BreckyHuddleston@gmail.com. See you next time for Dental Caries, Part 2.